on the exchanges, options that don't even cover the cost of her life-saving treatments. Joining me now is her son, Stephen Blackwood, his op-ed in the Wall Street Journal, making waves throughout the industry and across the country. And also joining us to discuss this is Avik, a senior fellow at the Manhattan Institute. I want to start first with Stephen. Your mother's been through quite a bit. I understand late this afternoon we found out that her current insurance company, Humana, will cover it's one medication specifically that she needs, and they'll cover it for one more year, but then all bets are off, correct?
That's right. That's exactly what we've learned, and I think, though I'm happy to know that my mother has something for the next year, it does raise a very difficult question, and that is, if it takes an op-ed in a national newspaper, several television appearances, dozens of hours on the telephone, and two different conversations with the VP of the company just to get one medication covered for one woman, we've got serious problems to think about.
And you have detailed what your mother went through, the confusion with the exchange, the federal exchange trying to get coverage, the confusion at Humana when they first said, yeah, this will be covered, but we don't know for sure because we don't have the formularies yet. Buy it and then we'll cover it. And then, of course, saying no. Vic, is this an uncommon story? Because critics of Mr. Blackwood are saying this isn't accurate. We're hearing a lot of this, though, aren't we?
Yeah, it's both of those things. So it is a common story. There are hundreds of thousands, if not more, people who are struggling with higher premiums and less choice. And that's the real problem here. It's one thing if you freely choose a plan that has a limited drug formulary because you wanted a lower premium, and that's your choice, and you have to deal with that. That's just what insurance is in the real world. That's not what's happening with Obamacare. People are paying higher premiums for less choice, narrower networks of doctors, and higher deductibles.
In fact, Stephen, I want to, we're familiar with Harry Reid's comment, but I want to play this soundbite and get your reaction because he's essentially addressing your mother. I believe we have the Harry Reid soundbite ready where he says stories like this are just false. Let's roll that.
Despite all that good news, there's plenty of horror stories being told. All of them are untrue, but they're being told all over America.
He said these stories like your mother's story, are all untrue. And in fact, critics trying to defend Senator Reid say that this isn't a problem with the Affordable Care Act, Obamacare. It's a problem with the insurance companies, that Blue Cross Blue Shield originally dumped your mom because of cost, not because of Obamacare, and that Humana isn't to blame for this. How do you respond to them and to Senator Reid?
Well, a couple things. First, of course, we have had our problems with Humana, but people telling us that our main problem is with Humana is like telling someone whose house just got blown down in a hurricane that the real problem is with their new contractor. It's just not true. The plan was canceled because of the ACA. And as for Senator Reid's comments, if I'm not mistaken, he made those comments in the Senate the day after another senator read a good portion of my op-ed on the floor of the U.S. Senate. Unless Harry Reid wasn't at work that day, I have to take those comments personally. And when you have elected officials calling honest citizens liars, you know, playing politics with people's health, to me, it seems to me like we might need to elect some new politicians.
You know, it's not just Harry Reid either. I was in Washington a couple of days ago for a conference sponsored by the Health Insurers Trade Group. There were a number of Democratic congressmen there. There were a number of prominent progressive healthcare columnists and pundits there. They were all echoing this line that this is all exaggerated. This all doesn't check out. If you look at these stories that people are talking about, they aren't real. And that's not true. And it's not just true because we're hearing the anecdotes. People are writing the op-eds, complaining to the president of Humana, etc. You know, studies that we've done at the Manhattan Institute show that the average increase in a premium post-Obamacare versus pre is 41%. So you can imagine that people are struggling with that.
Is Stephen's mother caught in the fact that she might have an income that disallows her to take advantage of benefits should she have been less wealthy? And I'm not saying your mother's wealthy, but if she had been impoverished.
Well, I mean, I don't know the specifics of the income of her situation, but in general, actually, what's going on is elderly people are getting more heavily subsidized on the exchange than they did before. It's young people who are really suffering overall, but in her particular case, could that be true? Absolutely.
And Stephen's mother, I believe she's roughly about 49 years old. I don't want to confirm that because you never, talk about a woman's age publicly. But let me ask you this, Stephen. There was a quote. The L.A. Times took big issue with your article, and they said that perhaps the exact opposite of centrally managed health care is what we need here. In fact, quote, as advocates of a single-payer system argue, if it were centrally managed, it might work better. What do you respond to the author of that LA Times article?
Look, I'll first say that I won't divulge my mother's age, but that was at the time of her diagnosis in 2005. Look, about the comments of the journalist in the LA Times, let me just say that I really do think at the root of this issue is the question whether increasing the power of the federal government is the answer to our most complicated problems.
I think that's a good
question. And I think I disagree with the journalist at a pretty fundamental level about that question. And let me also say, look, I come from a medical family. I'm a very strong proponent of expanding coverage in this country in intelligent and affordable ways. But the new plans should not be worse than the old plans, and they shouldn't be taking choices away that free individuals had earlier made.
Let me make a quick point.
Sure, go for it.
In the UK and Canada, which have single-payer healthcare systems, they actually have some of the worst outcomes for cancer in the world, particularly UK. The UK has the worst performance. If you get diagnosed with cancer in the UK, you're less likely to live longer than any other developed country.
I'm going to leave it there. Avik Roy and Stephen Blackwood, most important, Stephen, we wish your mom the best. I know that we're going to try and perhaps have you and your mother join us when Jerry gets back. She's a little under the weather right now. But again, our prayers are with your mom, and just we wish you all the best. Thank you very much for joining us.